Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Hospital Anxiety and Depression Scale assesses the presence and severity of anxiety and depression symptoms in patients. It is designed to identify psychological distress in individuals with various medical conditions, particularly those hospitalized or receiving outpatient care. The scale consists of 14 items divided equally between anxiety and depression subscales. Its main purpose is to provide a reliable and valid screening tool for detecting emotional disorders that may impact medical treatment outcomes. The scale facilitates early intervention and supports integrated care by assessing mental health alongside physical illnesses. The Hospital Anxiety and Depression Scale is indicated for adult patients in medical outpatient and inpatient settings. It is particularly useful for individuals with physical health conditions where symptoms of anxiety and depression may be difficult to distinguish from somatic illness manifestations. The scale is validated in populations including those with cardiovascular disease, cancer, respiratory disorders, and chronic pain. Its primary clinical application is in screening and detecting clinically significant anxiety and depression symptoms to inform further psychological assessment or intervention. The tool performs reliably across diverse medical populations, demonstrating sensitivity and specificity values generally above 0.80, making it suitable for routine mental health assessment in general hospital environments. The Hospital Anxiety and Depression Scale consists of 14 items divided equally into two subscales, anxiety and depression. Each item presents a statement related to symptoms experienced in the past week. Respondents select one of 4 response options per item, ranging in severity or frequency, scored from 0 to 3. Administration involves reading each item aloud or providing a written questionnaire for self-completion, ensuring the patient understands the time frame and response format. Total scores for each subscale range from 0 to 21. Scores from 0 to 7 indicate a normal range. Scores of 8 to 10 suggest mild anxiety or depression. Scores of 11 to 14 represent moderate levels. Scores 15 and above indicate severe symptoms. Interpretation should consider clinical context, as the scale is a screening tool rather than a diagnostic instrument. The Hospital Anxiety and Depression Scale demonstrates varying sensitivity and specificity depending on the population and cutoff scores used. Sensitivity refers to the test's ability to correctly identify patients who have anxiety or depression, while specificity indicates the test's capacity to correctly exclude those without these conditions. Studies report sensitivity values ranging from 0.70 to 0.85, meaning the scale accurately detects 70 to 85% of true cases. Specificity values are generally between 0.75 and 0.88, indicating it correctly classifies 75 to 88% of individuals without the disorders. For example, in a clinical setting, a sensitivity of 0.80 allows clinicians to identify 80 out of 100 patients who truly have anxiety or depression, whereas a specificity of 0.80 means that 80 out of 100 patients without these disorders are correctly recognized as not having them. These metrics support the Hospital Anxiety and Depression Scale as a reliable screening tool, but highlight the importance of confirmatory assessments following initial screening. The Hospital Anxiety and Depression Scale was developed in 1979 by Zygmunt and Snaith to provide a brief screening tool for detecting anxiety and depression in patients within hospital settings, minimizing the influence of physical illness symptoms on psychological assessment. Since its inception, Numerous validation studies have confirmed the scale's reliability and validity across diverse clinical populations and cultural contexts. Reported internal consistency values for the anxiety and depression subscales typically range between 0.8 and 0.9, indicating good reliability. Construct validity has been supported by significant correlations with established measures of anxiety and depression, while factor analyses generally uphold the two-factor structure of the scale. Test-retest reliability assessments conducted over intervals from 1 week to several months demonstrate stability of scores over time. Cross-cultural validations have adapted and confirmed the scale's utility in a variety of languages and healthcare settings worldwide. Additionally, meta-analyses encompassing multiple studies have demonstrated the scale's adequate sensitivity and specificity, often around 85%, for detecting clinically significant anxiety and depressive symptoms, reinforcing its role as a standard tool in both clinical practice and research. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.